we're going to be talking with Ryan McPherson. He's the Director of Corwell Mooring international policy advisory firm based in Washington, DC, and currently leads several public-private initiatives related to health policy, including the APEC Vaccines Task Force, the APEC Health Financing Network, as well as projects focused on antimicrobial resistance. Prior to joining Corwell Mooring International, Ryan was a principal Asia-Pacific Economic Cooperation Coordinator at the US Department of State, where he had responsibility for oversight of the US government's engagement with APEC and chaired the Life Science Innovation Forum. Prior to the Department of State, Ryan worked in the Office of International Health Affairs at the Department of Homeland Security. Ryan worked as a scientist at Stanford University in the Immune Disease Institute at Harvard Medical School and earned his PhD in microbiology and immunology from Stanford University in Medicine. Ryan, it's an absolute pleasure to have you with us today, and I really look forward to the discussions over the course of the next hour. I really encourage people to put questions into the chat function, and I will call on those people to either ask the questions or I will ask the questions on your behalf. So please populate the chat function, because I'm sure everyone's very interested to learn more about APEC, Ryan's background, what he does and what he's been doing. So perhaps, Ryan, we can start off by learning a little bit about APEC and how you became involved from the perspective of international policy and advisory at Corwell Mooring International.
Great. Well, thank you very much, Greg. And I did not know this is Luana's last day, so let me thank you as well. We have not worked together for too long, but I could tell already that you've clearly made a number of different valuable contributions to this work. So I feel fortunate that I was able to be here on your last day. So APEC, it's a regional organization. There's 21 member economies. We call them economies because we have Taiwan, or Chinese Taipei, is known in APEC, and Hong Kong as separate members, just like we would have in the WTO. It's a group that's focused on economic cooperation, on technical cooperation, on promoting economic growth. And one of the things that I think is very useful within APEC is that we bring together a bunch of different ministries to tackle big problems. So whether it's health ministries, finance ministries, ministries of economy, ministries of industry, all of these ministries coming together with actually heads of state to both provide kind of top-down leadership on important policy issues, but then also to develop capacity building programs that help developing economies meet those commitments. And so I became involved in APEC through working at the US Department of State. With my background in health, I've now moved on to Corwell Mooring International, as you noted, which is a advisory firm based in DC, but we have offices kind of throughout the world, and work on a number of different capacity building programs, including those on vaccines.
Those capacity building programs, can you tell us a little bit about them and where they're working and what's involved in those capacity building programs? That would be really interesting, I think, for our listeners.
Yeah, so I'll start off with the vaccines task force. That was a organization or a kind of initiative that we started in 2020. It was actually a member being in Malaysia in February of 2020, where we were just starting to talk about this thing called COVID and what would be the impacts of it, and had really no idea that it was really going to kind of change the world as we know it's kind of going forward. But it was a group that was started together with the US government and the Public Health Canada. It's focused on life course immunization. So this really is something that was not a response to the pandemic, but really was something that we saw as a necessary initiative to really focus on vaccination throughout the life course. In APEC economies, and I imagine in a number of countries throughout the world, we tend to do a pretty good job with childhood vaccinations, pediatric vaccinations, even up to adolescent vaccinations. But when we get to adult and older populations, we really are kind of missing the mark in terms of those vaccination rates. And so we established an action plan. It has a set of core recommendations in it. These are things like promoting the recognition of vaccination, promoting access and uptake to vaccination, looking at developing confidence in vaccination, looking at financing. And then we established a series of commitments around these goals. And then we have a dashboard where we actually measure how APEC economies are doing against those commitments. So for example, just to give you a little case of what we're doing in terms of commitments, we have all APEC economies have committed to introduce standardized systems to generate data on both the direct and the indirect benefits of vaccination. What we've found is that a lot of APEC economies, they're looking at kind of those qualities and dollies and the kind of the direct health impact, but they're not looking at the broader economic and social impacts of vaccination. So that those quality of life issues, the fact that you aren't missing work, or you're not having to take care of someone who might be either missing work or school, those types of things haven't been included in when we're calculating the value of vaccination. So we're looking at kind of bringing in experts, academic organizations, other international institutions to talk with APEC member economies and show them why by utilizing better data, for example, they can get better policy results.
Yeah, it's a really important aspect in terms of how do you actually measure the cost benefit of immunization, particularly around older people, to enable them to maintain their quality of life, but their caring relationships, their grandparenting, their husband and wife roles and responsibilities they're giving to the community, and their work-life commitment. It's underestimated the impact that immunization has. And you talked about briefly about immunization. I know we've just recently had finished a 34 country looking at NITACs in terms of who's doing the recommendations and approvals. And it was interesting that out of the 34 countries, most countries don't have anyone that's got an aging background sitting on NITACs who are making recommendations to governments. So most people are focused around younger children, very few representations of people that have perspective of aging. So one can understand perhaps why aging and immunization doesn't seem to have the priority that it should have globally. But certainly it's something that your organization works on and we work on, and others around the world. So an interesting aspect. So when it comes to the Asia Pacific region, what are some of the strategies that you're instituting to combat health inequities and the models of good practice considered in the region? Do you have any really good models of good practice that you're aware of in the APAC region?
Yeah, I think there's a number of different things that countries can be doing. One, a lot of it does come down to public awareness. I think the public awareness campaigns can be extremely important about educating both the public about the benefits of adult vaccination, whether that's through TV, radio, print, digital campaigns, but then also educating even the healthcare practitioners themselves. There's sometimes just not a general awareness of the benefits of adult vaccination with some healthcare practitioners. Another thing that we've seen to be successful is integrating vaccination with other health services, so bundling that adult vaccination with other health services that are being provided, and really integrating that adult vaccination into primary care. Another thing that we've seen to be that's been very successful, particularly when we're looking at health equity issues, is the financing issue. I mean, subsidizing those vaccine costs can be very important for elderly populations, in particular, that are living on a fixed income and may not have to make very difficult decisions between health and food and rent and things like that. And then we've also seen APEC economies kind of use innovative ways, including mobile vaccination units. So actually going to the communities that may have some disparities in terms of their vaccination rates, and actually kind of going to those locations, meeting them where they are, whether it be in religious sites, in nursing homes, in other places where there may be some discrepancies and deficiencies in terms of vaccination. And then also just looking at who's actually giving those messages, engaging community leaders. For example, there's actually a program in Malaysia where they were working with religious leaders because they were such a trusted source of information within the community to talk about the value of vaccination. We've seen other APEC economies look at workplace vaccination programs. And then obviously, again, I'll come back to this kind of repeatedly, but the data collection surveillance is always extremely important. So you actually know who is actually getting vaccinated and then kind of backing that up with data and evidence.
Thank you very much. So please join in the conversation with Ryan. So please put some questions for Ryan into the chat function, and I'll call on you to raise those questions. Ryan, can you tell us how you started your interest in immunology and your work going to Harvard, to Stanford, and where you are now? Is this where you saw yourself fitting in the world when you first started?
Yeah, it's funny. I had a professor that was a biophysicist, and he kind of described the motion of molecules as kind of a random walk, and that's probably a good description of my career. It was definitely not a linear path from where I started to where I am now, but I've always been interested in the sciences, and so thought I was originally going to be a medical doctor. Was at the Immune Disease Institute at Harvard, working with a number of residents there, and I was more interested kind of in the science and kind of the discovery aspect than I think I was kind of the 80-hour work weeks and taking blood pressure, so, which is still very important. Do not want to disparage that for all of the MDs and ODs on this call. But then another actually big reason was that someone told me that if I got a PhD versus an MD, it would be free. So that was also a very good incentive. So I applied to the PhD program at Stanford Medical School, did microbiology and immunology, actually focusing more on infectious disease, and then kind of realized that moving small amounts of liquid from one tube to another was kind of didn't want to be my focus for the rest of my life. You really do have to focus on the minutia in science to really make advances a lot of times these days. And I just couldn't imagine kind of studying the same thing and the same kind of like aspect of a very specific problem for the rest of my life. So I did a policy fellowship that brought me to the Department of Homeland Security and the Office of Health Affairs. This was in 2009 during the H1N1 influenza pandemic. So that was very interesting. And then went to the State Department after that, focusing on APEC. And so it has been a very interesting kind of career progression in terms of looking at science, looking at policy, but I think it's all been very useful because just the way you think about problems within graduate school, the way you think about problems within policy, I think it's helpful to have people that are kind of looking at both of those issues.
Yeah, certainly is. I commend you for the directions that you've taken and where you are now. For many people, going from university doctorates to state departments or government, and then moving from government to private sector, it's a big challenge and a big shift from what people are generally used to. I'm sure that you would have experienced that, as I have, being a former public servant, moving to this sector that I'm in now. So thank you for your work. Can you tell us a bit about how the pandemic impacted the prioritization of health prevention, and most particularly investment in vaccines across life course?
That's a really great question. So I think there's a number of things that kind of impacted the way we look at vaccination because of the pandemic. I mean, one, I think there's probably both good and bad things that happen. I mean, one, there's certainly an increased focus on vaccination. I mean, before the COVID-19 pandemic, people didn't really think about vaccines on a daily basis as we did during the kind of height of the pandemic. I think there was also, at least within the governments that I've worked with, there was a much better appreciation for how health can impact economies. I mean, before the pandemic, it was very difficult, honestly, to get an audience of finance ministers and health ministers together. Finance ministers kind of just saw health as kind of another cost that they would have to provide expenditures for rather than an investment. And I think during the pandemic and now even afterwards, I would say most finance ministers probably have the health minister's number on speed dial or memorized by this point, because there was such a profound impact because of the health emergency and on the economy. I think another thing that the COVID-19 pandemic proved was that if the political will is there, then we can vaccinate large proportions of the population rather quickly. So I think there was at least just a belief, particularly in some of the developing economies within APEC, that there's no way that we could reach this 90% level of vaccination for this disease, or there's no way that we just don't have the infrastructure available to vaccinate this many people. But I think the COVID-19 pandemic showed that if the political will is there, the money is there, and the kind of the will of the people and the awareness is there, that you can vaccinate large proportions of the population very quickly. And so we did get increased public health funding because of it. There were also a number of innovations because of through kind of digital health. Because we had to isolate and separate ourselves to reduce the transmission, there were a number of different digital health solutions that were used and still can be used today. I will say that the public trust and vaccine hesitancy, that was kind of very different just depending on the different country that you were in. So there were both kind of good and bad things on that. I think we also saw some great global collaboration between countries. And then on the other side, I think there definitely were challenges to routine vaccinations. We saw millions and millions of doses of vaccines that were missed throughout the pandemic because people just were essentially afraid to go to the hospital if they did not have COVID. And so there were a lot of missed opportunities. And so now we are in the process of trying to catch up essentially on those missed vaccinations. So I would say there are certainly both good and bad things because of the COVID-19 pandemic.
Yeah, it's interesting when you're talking about how the pandemic really mobilized governments to actually respond very quickly, and health ministers governments investing in COVID-19 vaccines and the programs. It's one of the things that I've always known and always see is that for a government to understand the long-term benefits of vaccines, it's much harder to actually convince ministers because they're only thinking of themselves for a 4-year term or a 5-year term. And of course, we know that the benefits and the health outcomes of people having up-to-date vaccines is a lot longer time frame than that. So it's the economic benefit that we can actually measure somehow to actually get governments to know that it's the right thing to do. How do we convince governments that it's the right thing to do to invest in health prevention, health promotion through immunization?
That's a great question. I cannot agree more. I mean, if you just think about it, it's always going to be much more appealing for politicians to stand in front of a big bridge or some other road or something like that than to know, 10, 15 years down the line, there'll be healthier populations and reduced costs. I think what we have found is just by showing government officials the data and evidence that by investing in prevention, investing a little bit now, you'll be able to save much more. And some of these interventions can actually be realized kind of sooner than 10, 15 years down the road when these people are retired. But I think just showing the data and evidence of that return on investment is very important so that they can see we get this cost benefit ratio that is far exceeds anything that we would get from most hard infrastructure. So
yeah, look, it's that data and that evidence that is much needed to be able to demonstrate and show governments that what the benefits are. I remember some years ago doing some work with Pfizer in Mexico, and in that particular country, they were looking at the cost of pneumococcal pneumonia and the hospitalization rate and the average length of stay being 18 days at that particular point in time, which is a significant length of stay in a hospital and a cost which could have been avoided through immunization. But the interesting thing that I learned from that particular trip was that of those people that were hospitalized and didn't die, that their functional ability was reduced and never came back to full capacity. And a bout of pneumococcal pneumonia in hospital, your functional person is probably reduced by anywhere between 10 and 20% in the long term. Any thoughts about that?
I completely agree. Anytime someone's going to go into a hospital, particularly if you're here in the United States, it's going to be extremely expensive. And so anytime that we can, one, prevent that, it's going to reduce costs. But then also, we're always talking about how we need to have more resilient health systems. Anytime you can use these preventative measures to reducing the strain on our healthcare systems, you're making that system more resilient so that you can save those hospital stays for when they really are needed. That's something that we've certainly been making the argument to a lot of the governments that we've been talking with, that you really want to have a system that is focused on providing health instead of kind of treating illness, essentially. Yeah. So you really want to focus on that healthcare rather than the sick care, as they would say.
So there's been a few questions coming into the chat, Noel. Shmuel, who is a regular listener to our Global Cafes. Thank you, Shmuel, for your participation. His question for you, Ryan, is, according to you, what is the need and the role of WHO in encouraging life course approach in immunisation for reducing inequality in health services in poor and low income countries around the world?
So it's a great question. So, and a lot of the work that we're actually doing within APEC actually is based on the WHO I-2030 agenda. We're actually also take part in the WHO's life course immunization task force that is run by WHO, but has participants from a number of different health agencies kind of throughout the world. So I would say that the kind of role of the WHO is to kind of essentially set the commitments and the goals that economies and countries should be aiming for. And a lot of those goals are the same goals that we would actually have in our vaccine task force. So looking at promoting the recognition of the value of vaccines, strengthening confidence in vaccination, building those resilient immunization programs, incorporating vaccination into primary care, looking at things like regulatory harmonization for vaccines, improving financing. That's always critically important. I think the WHO is great for providing that overall goal and then helping those countries kind of meet that goal based on their specific context.
Thank you, Ryan. Another question from Cynthia Stewart. Cynthia, do you want to come forward?
Thank you. Actually, much of it on our conversation about COVID is really been addressed, but I just wondered, in your experience now during the pandemic, and the good and the bad and maybe some good, of course, can you identify any best practices in countries that can be cross-fertilized, whether it be the developed or developing countries? And then also, I just wondered if you actually had the data that showed what kind of drop-off for the routine things that people like in the US were used to getting, the flu shots, the pneumococcal during COVID, but then there have been some new methods of impacting primary care people to say, have you had? So I just wondered if you have data that shows the drop-off, but then you project an uptick again, because people are more educated about the power of vaccination.
So those are really great questions. So one, I think we did address some of these, but another thing that I'll mention is that just in terms of best practices that we saw during the COVID-19 pandemic is because essentially no one was safe until everyone was safe, and you really needed that essentially kind of approximately 80% vaccination rate or even higher, and sometimes to get that herd immunity, which is so important to really stop the transmission of disease. We saw a number of different programs to reach those essentially hard to reach areas. So for example, in Australia, they had specific programs that were targeting Aboriginal and Torres Strait populations. We saw specific programs in other countries where they're reaching either migrant workers or those that were usually kind of excluded from the public health system. Even in the US, we saw a number of programs that were looking at how do we access those that typically don't see public health care officials on a regular basis. So I think that was very important. In terms of immunization coverage for older adults, and I'll actually send some additional information that we have and some handouts and have those posted on the IFA website. We did see a number of different countries have a dip in their immunization rates. Just for example, in Korea, they were for influenza in around 2018, 2019, they were a little over 80% in terms of their vaccination rates. During the pandemic, that dipped down quite a bit. Still actually not too bad, but beyond like around 70%. So there certainly was a dip, but that is now coming back. So we are seeing, at least in some countries, people resuming those vaccinations. So that is a good sign, but there is also on the younger side, we saw quite a bit a dip as well, but we are seeing that recovery right now.
Thank you.
Thank you very much for that, and thanks for the question, Cynthia. I'd like to call on Paul Van Binder if he can unmute himself, and Paul has a very interesting question for you, Ryan. So, Paul, are you available?
I am, and thank you, Greg. And if this is your swan song, thank you for the work that you've done over the last many years with IFA. Ryan.
Not quite my swan song. I'll still be here up until December, so you'll still see me. It's Luana's swan song today, but not mine. All right. So Paul,
okay,
over to you.
Sorry. Yeah, and so Ryan, one of the things that's worried me about the post-pandemic period, as governments have decided to go to business as usual and pretend that we're not still in a pandemic, is that we're seeing very low booster rates in older persons, very low booster rates in aged care facilities. In Australia, we're still seeing literally dozens of deaths each week, almost exclusively in aged care and older groups. And hesitancy has flowed to our influenza rates, which are down 15 or 20% in older persons for the first time in 2 or 3 decades, with the confusion that surrounds changing pneumococcal programs, the imminent availability of RSV vaccines for older persons, changes with zoster vaccine, changes with pertussis vaccine. I wonder if you've got any thoughts on how we overcome this sort of almost global hesitancy that's set in as part of COVID fatigue in older persons, and how we actually get the public themselves to increase their support of older persons' vaccines.
It's a great question. I think we probably all at some point have suffered from some COVID fatigue at some point, kind of living through this for 3 years now. I think what we've seen being successful is those public awareness campaigns. So for example, in Singapore, the health agency there is actually collaborating with private sector, with other non-governmental organizations to develop public awareness campaigns. And so those kind of advertisements on the buses, advertisements on other areas, public communication ads. And I think those are just very important. I mean, even myself, I'm pay attention to it quite usually, but I mean, even I'm like not completely, if I know exactly when I need my next booster at this point. I'm pretty sure I need to get it when I get my influenza vaccine, but I'm not totally sure. So I think there does need to be more in terms of those awareness campaigns. And also just presenting that data and evidence that the COVID vaccine is not, or the COVID pandemic is not over. I mean, we were actually just reading the other day on new variants that seem to be able to evade immunity better than others. And so I think that awareness is going to be very important, both on the healthcare practitioner side and also on the public side.
Thanks for that, Ryan. And I think it's probably really important. And one of the things that we talk about a lot is bringing like and unlike organizations together. And I think there's a real role to play for anyone that's in the aging sphere to be looking and reaching out to organizations which perhaps don't have older people at the top of their mind in the work that they do, to be trying to get them to understand, to promote the life course approach to adult immunization and the importance of vaccines. So it's that public awareness campaign extending beyond just the quotas of Quota Australia or National Seniors Associations or AARP in the States. It's about getting other organizations, diabetes, heart and lung, those types of organizations to be talking much more about their older constituents and having adult immunization schedules up to date. I know I'm up to, I think, my 6th booster shot coming up this year. So it's a interesting dilemma, Paul. So thank you for that question.
I'll just add, just on the theme of kind of the messenger matters. I was actually at a meeting and we were kind of talking about some best practices and kind of innovative ways of delivering that message. And I mentioned the Malaysia going to religious sites. There's actually, I won't name the country, but there was a country that actually had a program where they were introducing the idea of encouraging adult vaccinations by actually teaching it in schools and having the school kids and the younger people actually talk to their grandparents, talk to their parents about the importance of vaccination. And so they were finding that by having actually a younger person ask their grandparents about whether they've been vaccinated was actually an effective way to get people to think about vaccination. So that was another thing that I thought that was pretty innovative.
Yeah, absolutely. I mean, for grandchildren to be telling grandparents that they want them around to be maintaining their grandparenting role is not going to happen if they get sick because of a lack of vaccines. So can I now call on Yagana Imam? She has they have a question that I would like them to pose to you.
Good morning, good afternoon. I'm just thinking about countries like my country where we have very little resources that is allocated for health, and there's a lot of competing health issues for that meager resources. So how can one really convince authorities about the benefit of adult vaccinations as compared for child health vaccination? Because we have so many childhood diseases that require vaccinations, and most of the vaccinations are actually imported and it is costly. So how can one really convince authorities and advocate for the importance, economic benefits of adult vaccination?
Yeah, Ghana, before Ryan asks that, so tell me what country you're in.
Nigeria.
Nigeria, thank you.
That's an excellent question, Yagana, and hopefully this is not an either or question of either vaccinating adolescents or vaccinating adults, but it's a yes and issue of both vaccinating children and adults. I think it actually comes back to some of the messages that Greg was mentioning earlier in terms of those extreme costs for hospitalizations. And we know that older populations with immune senescence are more susceptible to a number of diseases and have kind of reduced immune capacity to fight those infections. When they do have ladies and they do need to go to the hospital, those hospital stays can be extremely expensive. And so I think making the argument that you can actually save money, save those meager resources that you have by focusing on prevention, I think can be a very powerful tool, because by the time the person gets sick, it's you're going to be expending so much more in terms of resources to get that person well again versus preventing the disease in the first place.
Thank you for that, Ryan. That really brings me to the question of, what percentage of GDP should governments be spending on health promotion and health prevention as opposed to medical interventions? Because I know it's probably an underspend in every country, even developed countries. And I know the amount of money spent GDP for health promotion, health prevention in Canada is very low. Similar in Europe, and probably the same in Asia. Is there any benchmarking that's ever been done around what percentage of GDP should governments be spending on health promotion, health prevention?
Probably is. I'm not aware of a specific number in terms of kind of a recommended amount. I mean, there are kind of numbers just in terms of general expenditures that kind of WHO and others have put forward in terms of how much money should be spent by the government on health in general to prevent kind of extreme out-of-pocket payments and kind of to help ensure kind of a progress towards universal health coverage. I know when I was actually at the Department of Homeland Security, we worked quite a bit with FEMA, our emergency management agency, and they actually had in law for a while program where for every disaster that took place, they would actually have to spend 10% on prevention. So whatever they spent on recovery from that hurricane or other disaster, 10% of that would then have to go towards prevention and making the system more resilient. But I think it is a interesting question. I can guarantee you that we definitely do not spend enough on prevention because as we were talking about earlier, one, it's you don't see those benefits until a lot of times the decision makers are long out of office, and it is much easier to make the argument of needing to treat an exigent issue than to prevent one from happening. So.
Yeah, wouldn't it be a great world if we could get governments to actually commit around the world a percentage of their health budget towards health promotion, health prevention, which was agreed. Perhaps it's something that WHO should be pushing much more. Paul Van Binder has come back in saying a guide of 5% on health expenditure for prevention was agreed, but rarely met. Often a fuzzy measurement. So I don't know of any government that would probably be spending anywhere near 5% of their GDP or health budget on health promotion, health prevention. So it's a challenge for all of us. Yep, indeed. So I want to come to the question of antimicrobial resistance, AMR, and the importance to have this on government agendas because it's fairly new. So can you talk a little bit about the project, your projects or work around AMR and the importance?
Yeah, so I think it's actually there's a lot of kind of intersections between AMR and obviously older populations and vaccination. So we know that there is an increased vulnerability with aging, as we said, as these immune systems weaken, people are more susceptible to infections. There is a fair high antibiotic usage in older adults. There's often kind of multiple health issues that they've had. They do have a more frequent hospital visits, and so they can get those hospital-acquired or nosocomial infections. And so there's secondary bacterial infections and almost any kind of invasive procedure that takes place in a hospital, whether it's for osteoporosis, for any or surgeries, or for other issues related to bone health, which we also know is an issue among older populations, is going to have the risk of infection that may be difficult to treat with existing antibiotics. And so the work that we're doing within APEC has kind of three primary areas, and one that we're actually focusing on in particular. So there's obviously the importance of looking at surveillance, so seeing where this antimicrobial resistance is erupting. They often call it the silent pandemic. It's kind of, again, similar to aging populations where we know it's coming in terms of antimicrobial resistance. It's one of those things that you can count on microbes developing resistance to our the drugs that we develop. It's not a question of if, it's just a matter of when. And so it's kind of similar to the growth in aging populations. We know that we need to be spending more on our health systems to support elderly populations. And so it's not a question of if, it's just a question of when we're going to do that to strengthen those health systems. The other issue we're looking at is on stewardship. So just making sure that we're using antimicrobials when they're actually appropriate to use. We've found in a lot of APEC economies, antimicrobials are relatively inexpensive compared to a number of other treatments. Folks will come in, they want something, whether it's a bacterial infection or a viral infection, they just want something to take. And so doctors oftentimes will give them something, even though they might suspect that it could be a viral infection or may not have the diagnostic ability to differentiate between a bacterial, fungal, or viral infection. And the thing that we're really focused on within APEC right now is trying to fix essentially the market for the development of new antimicrobials. So if you look at kind of a general market development for pharmaceuticals, I mean, you have the discovery, it goes through various clinical trials, goes to market, and then you sell that drug to those that need it. With antimicrobials, you basically want to develop that drug and then keep it behind essentially a glass wall and use it essentially to break that glass only when necessary. So you want to use it as little as possible. And so that is a very different model from a lot of other drugs, like statins and other things like that you're just using on a regular basis. And so how do we incentivize development for those types of drugs, which are absolutely critically needed? There's been a number of studies showing huge impacts to GDP due to AMR if we don't solve this problem. And so how do we incentivize companies and others to develop these antimicrobials that we need for not just treating antibiotics, but really just for healthcare in general? And if we're not able to treat bacterial infections, we're kind of risking modern medicine in general and kind of going back to the 19th century in a lot of ways. So what we've been doing is looking at different models. So there's subscription models, kind of what they call them, like the Netflix model, where governments would pay kind of an upfront cost and then have the ability to access medicines as needed. There's been work looking at kind of prizes for developing new classes of drugs. There's been talk about looking at kind of giving regulatory approvals for other drugs that are more commercially relevant for those companies that develop antimicrobials. And so we're looking at a number of these different models to see what might work within different economies. But there is certainly a huge deficit right now in investment. Carbex, which is based out of Boston University, and Kevin Outerson came out with a paper indicating that there's at least a $370 million annual deficit in the amount of funding that we need to be providing to antimicrobials if we want to develop these new drugs compared to where we are now.
Wow, that's very significant and clearly something that governments need to be responding to. It sort of raises the question for me, since COVID and the very quick implementation of new drugs to support and combat COVID, we're now starting to see a lot of other drugs being developed or approved. And we talk about the hesitancy of older people. Is it possible that we actually start bringing on too many new drugs for immunization programs? And I know we're just starting to see the RSV immunization program being publicised, rolled out, and advertised that older people should be immunised against RSV. So any thoughts around how quickly drugs are being developed at the moment? And then the other question that I have on that is, drug companies spend a lot of money on getting drug approvals in every country. They've got to go through a significant approval process. And I know there's probably some countries which I would probably support and say, I'd be very happy to have a drug which has been approved by Australia or the US or Canada or Denmark or Sweden. But how do we actually get some uniformity around drug approvals, which is going to bring down the cost of drugs, because drug companies are having to spend so much money for those approvals in every single country in the world?
Well, those are two great questions. And so in terms of the first one, kind of the speed of kind of the development of new drugs, because of a lot of the developments within particularly molecular biology and the ability to sequence organisms very quickly now, I think we are seeing a bit more in terms of precision medicine and being able to kind of essentially diagnose ahead of time what treatments a person might respond best to. And so I think that is actually going to be very beneficial, so that we're using the right treatments for the right patients. I think that's going to be extremely important. In terms of vaccines, I don't think we're developing them too quickly. They actually still take quite a bit of time to develop, but the mRNA platform, I think, is going to be extremely important going forward. Our ability essentially to kind of design a vaccine based on the sequence, I think, is just going to be extremely helpful in terms of responding quickly to new, particularly viruses as they develop. So I think that's extremely exciting platform right now that's been developed, and hopefully will be able to be applied to other diseases as well. In terms of looking at the regulatory issues, that is an extremely important issue, and actually one that we're also looking at within APEC. A lot of the things that we're trying to do now is looking at what we call regulatory reliance. And so working with regulators from particularly developing and emerging economies, and talking with them and showing them how they can use regulatory information from other competent authorities, whether that's the US FDA or MDA or JPMA in Japan, and use that information instead of redoing all of the clinical trials themselves. Because one, it does add additional cost to bringing new drugs to market, but it also delays that introduction of those new drugs. And there's not any kind of benefit in terms of safety and effectiveness. You're really just kind of delaying and causing more cost. So that is something that we're certainly looking to do, is working with a number of different regulatory authorities in the region, and helping them to work on and use regulatory information from other competent authorities.
Okay, thank you for that. That sort of brings me to another question. And what, with the development of AI and where AI is going to, what role perhaps is there with AI in development of vaccines in the future?
Well, I think we're going to see, particularly with things like the mRNA technology, I think that's going to be extremely important. We're going to be able to kind of model the way, for example, RNA and protein folds, rather than having to actually kind of do it strictly by experimental basis, which, as a former scientist, I can tell you that usually about 90% of the things you do don't work. And so when you can use computers to model how you think things will happen, and then use that to test things in the lab, it just speeds things up so quickly. So I think that's going to be extremely important. I think there's also going to be, it's going to help a number of physicians in terms of being able to particularly look at rare diseases and other things that they're not going to have an encyclopedic knowledge of. It's never going to replace the kind of that human interaction and the human doctors. So I don't think any of the physicians on the line have to worry about being replaced by an AI bot anytime soon. But I think it is going to be extremely important, and it's going to enhance the care that we get. So it's a very exciting time, and it's evolving extremely quickly right now. So I think there's going to be a number of different innovations that are used, and I don't see it as replacing that human intersection, but I do see it being enhancing it.
All right, thank you for that, Ryan. Paul, Paul Van Binder, you've got a couple of comments in these couple of question areas. So do you want to come back online and have a chat about that? What your thoughts are?
Thanks, Greg. One of the things that happened during the pandemic was that governments got involved in the actual support and development of vaccines. And where they did, they ended up being less expensive than when the company was allowed to develop them themselves. And I think that there's been a potential for that to continue as we look at mechanisms to actually provide vaccines that can be afforded by broader companies, particularly in the Asia Pacific region. I've seen that the process of technology sharing in places like India has led to the provision of vaccines that are more widely available at a better cost. I worry particularly that some of these new vaccines for older people are being marketed at a rate of, $400 or $500 US for a course, and that's just not affordable to most of these. And it's because we've been hands off, letting companies develop the vaccines and then say, well, it costs us a lot of money, we're going to make a lot of money out of it afterwards, and then having massive profits that they justify based on the development. I'm hoping that things that are happening in Australia with the co-development of mRNA plants and things that are happening whereby government supports some of this basic research and helping to get vaccines to market will actually make them more affordable. And obviously, the use of technology transfer and the sharing of IP, I think, is really important in trying to make this something that is affordable to developing nations rather than just those that can afford to pay a monstrous amount because their GDP is so much higher than other countries. So I think that's important. I think the other thing gets back to what Ryan's been saying earlier about educational programs and the importance of those. I mean, we need people to understand that while they're tired of COVID and they've got flu and various other things, that RSV is a significant issue in older persons. And while there are companies trying to develop a mixed vaccine, RSV and COVID and flu in the single needle, we need governments to understand that RSV is associated with significant hospitalisation costs and morbidity and long-term morbidity as people develop disability after being hospitalised with disease. So I think, we give in many countries about 15 antigens to children. There's no reason why we should restrict ourselves to 1 or 2 in older persons.
Ryan, any comments?
I would say, I think there's clearly a role for government and clearly a role for private sector and then other non-governmental organizations in developing these new innovations. I think what we saw, particularly for the COVID-19 pandemic, but I think also for other kind of emergencies going forward, is I think governments have a huge role just in terms of, one, providing those resilient supply chains, providing that extra capacity. If we want to be ready for the next kind of emergency, essentially, it is going to cost money. And so I think that is an area where governments can contribute, is having that additional supply, those extra stocks, those emergency stocks, so that you have them when you need them. I think that's a role that kind of uniquely government is really suited to play. Business is not really able to have a lot of times those types of stocks and still or that excess slack in their capacity and still be a functioning, profitable business, but it is extremely important for governments. And I think also work in terms of creating a stable marketplace and creating an environment where it makes sense for innovation to take place. And particularly, we've seen this with antimicrobials. I think there's certainly a huge role for governments in terms of creating that environment where it makes sense for innovations to take place. And then if that money is used, I think there's certainly issues that need to be addressed in terms of access to those medicines. And so I think there's certainly a number of lessons that we can learn from the COVID-19 pandemic.
Thank you very much, Ryan. Look, we are coming up to the top of the hour, so the hour has gone very quickly, and probably quite often these hours do go too quickly. And I want to thank you for the conversation today. While I introduce, I hope, next week's speaker, I'll let you think about what is your takeaway messages that you want to give to people that are on the line today for them to take away to their colleagues and networks. So do we have next week's speaker? We do. So next week, we're going to be in conversation with Joanna Maxwell, and she's the project director, Age Research. So changing perspectives, lessons from ageism awareness to intervention. So please join us next week for what will be, again, another riveting discussion with an expert from across the globe. So I do thank you for all of those participating today. I certainly want to acknowledge the comms team, and a particular thank you to Luana, who will be leaving us today. So Luana, you've been an absolute gem and wonderful to have in the office, and we will all miss you. So thank you for that. And Ryan, I will hand it over to you to lead us out with what your closing comments are, and I will thank everyone that's online today. So thank you.
So, well, thank you so much, Greg. This has really been a pleasure being with you and the rest of the folks online. Really appreciate the opportunity here. I'll just mention three things as kind of takeaway messages. One, I just want to thank you for kind of bringing immunization and AMR in particular to the aging conversation. I think it's so important that we incorporate these issues into the aging conversation. So I want to thank you for doing that. And I hope that all the rest of the folks on the line are able to incorporate vaccination into their discussions when they're talking about healthy aging, because I think it is just so important. Two, I would just mention underscore the importance of this kind of public awareness and kind of bringing the attention of vaccination to older populations. I think that is really critically important and something that will really help in terms of increasing those vaccination rates. And then the third thing I will kind of leave people with is that if we've learned anything from the COVID-19 pandemic, is that we've learned that it is possible to vaccinate large populations or large percentages of the population if there is the political will, if there is the financing available. So it's not a question of really can or can't we do this? It's like, will or won't we do this? And so I just want to leave people with that if people say, oh, we can't do this, we can't do that, I think we have the evidence from the COVID-19 pandemic saying that we can do this.
Ryan, thank you. It's been a pleasure talking with you today. I know it's a long weekend for many of us here in North America, so enjoy Maryland with the kids and the wife and the dog this weekend. Enjoy those who are in Maine, and thank you for today. And please join us next week